Just a reminder to silence your cell phones as we get ready to begin. Good afternoon. We'll call this Bridging the Gap Subcommittee meeting to order. Welcome, everybody. Well, I better do the formalities because I'll get talking and forget to approve the minutes again. First item of business would be a motion to approve the minutes from the February 18th meeting. Is there a motion to that effect to approve the minutes?
So moved.
Been moved and supported. Thank you. Any corrections or additions to the minutes? All in favor signify by saying yes.
Yes.
Opposed, say no. Okay, very good. Minutes are approved. Well, I think I owe you all an explanation of why we have three presenters again today. When we left last time, we did have some discussion of the fact that there was going to be some administrative things we needed to deal with, particularly since we had had a proposal from the Sheriff's Department and we knew we weren't going with the proposal as it was presented, yet we all know there was a value of making sure they have access to the services they need, which I know is something we've all supported. So we did have a meeting with Commissioner Collins and myself and Ms. Zisk and Administrator Murphy and Captain Casey and Sheriff Pavir, and we talked at length about making sure we can really bridge the gap with the things that they need in their department. And I'm going to talk a little longer because in full disclosure, U-Turn Health had a severely delayed flight and the lady is coming quickly now and hopes to be here by 3:45. So it's going to take a little bit of time, so I'm going to extend this preliminary discussion. You know, the things that we identified in the Sheriff's Department is, first of all, we need to identify who needs medically assisted treatment and therapy. Then, of course, we need money for the medication, and we try to get a grasp on what that money would look like. For instance, one of the medications is quite cheap and the cost is not an obstacle. One of them is quite expensive. So of course we want to make sure there's money available for the treatment. But then we need somebody to diagnose the need as a medical doctor and to actually deliver the medication. But then we also understood that medication alone is insufficient without appropriate counseling and therapy during and after. And in the jail setting, post-release, it continues to be an important thing. So we understand that there's really a holistic, array of issues that need to be handled all at once. And while we had various pieces of programs that touched various parts of these, we wanted to make sure they were integrated in a way that they worked well. One of those other components is telehealth and how we were going to make that work, not just for inmates, but also post-release as well as the community at large. So after that initial meeting, Commissioner Collins and myself and Administrator Murphy and Ms. Zisk met again and took another pass at these proposals and thought there's really three providers, three entities that we think could benefit by a slightly revised approach to their proposals that we think can integrate together in a way that would fix the issues for the jail, the issues that are apparent. Also understanding, and I hope, because we know a number of the various proponents watch these videos, we see this as, at least I see this as a kind of a prototype year one, year two, because we are trying to gather data. We want to, of course, evaluate the performance of these programs and make sure that the needs are being met. Right now, we're dispensing about $1.5 million. We know there's additional monies coming. And I think most of us would agree, even though some of you have deep technical expertise, we don't know how all these things are going to work together, and we've done our very best to try and select the best programs available from the providers that brought proposals to us. So that's kind of the backstory of why we've asked these three entities to come back and speak with us. We know that the Sheriff's Department and McCullough Vargas have had some discussions, and McCullough Vargas is present in the jail now with programs, so we felt there'd be a good relationship there with them. And we continue to look for ways to improve this. So I guess my point is, this will be an ongoing process. Even once the contracts are signed, we're going to continue to need feedback and discussion. And a number of the proposals have asked for latitude to, as they get on the ground, shift the focus of their efforts depending on what the real world results are showing them. And I think we recognize that that's important. None of us want to be held hostage to a set of rules that aren't fitting the actual needs on the ground. So any questions about that? I don't want to just blab, but I did think you were all owed an explanation of why we're here with three more presenters, because we really thought we were done last month. Any thoughts or questions? Well, I thank you for your patience and for staying involved. You guys did see the sheet of the printouts, right? And so you see we got about 50,000, 40,000 left out of the initial $1.5 million that we've not currently allocated. And I will say that while we will look at each of these proposals individually, it's at least administratively, it's our hope that this committee would find this package of three proposals would be something that you can recommend forward, as, you know, kind of seeing them as a three-piece part of one program, if you will. So we will obviously give you a chance to vote on that when we get all done, but that's kind of how we've assembled it, seeing this as three parts of a solution. That being said, I'm more than happy to stop talking. Our next presentation will be out of order, but I would ask the folks from McCullough Vargas to come forward. I believe we have Melissa and Brian Vargas with us. Please make sure the green light is on the microphone there. If not, just push the button and the time is yours. What we're using, 10 minutes, did we say? 15 minutes. So
well,
welcome.
thank you. Thank you for having us. Thank you for inviting us back to speak. It's a pleasure to talk about recovery and the things that we do. So we weren't sure exactly what we were going to be talking about today. You know, we did put in a proposal for peer recovery coach expansion and some funding for that to fill, again, bridge the gaps in the community as we see them. And so you did mention earlier that we've been working with the Sheriff's Department and the jail, providing peer services and groups and individual sessions there. So far, that's been a great program. It is grant funded, and there is a timeline for that grant. And so, you know, one of the things that I thought about first with this was, you know, how could this supplement what we're doing? Or if there's something that the grant doesn't get renewed for the next year, how could, you know, some of these dollars help us continue to provide services in the jail? So I think that's one area that we're looking at that could be applicable for some of these dollars, is to continue the programming that we're doing, because I believe the grant runs through September 2026. So that would be one area. Another area that we're working on, we have a partnership with ProMedica to provide peer services in the hospital. That's still right now currently with their legal team working out some specifics about what it would take for us to have access to the hospital and all the ramifications of non-hospital staff engaging in services there. So that's another area that we see some of these dollars allowing us to do peer recovery services with people that have been admitted to the hospital for overdose or other substance related incidents. And then how can we continue to support them in their recovery, get them linked to services either with us or other providers, be it outpatient services, residential services, detox, whatever it might be. So those are some of the things that we've been thinking about with this.
So those two populations specifically, people who are incarcerated or people who are in a hospital setting, an outpatient provider cannot bill their insurance. So this is a gap where, even though they are in the hospital, we can't provide those peer services while they're there in the emergency department where they might most need it. They just experienced an overdose event. Now they have been revived using naloxone or something like that, or they're in there for liver failure and they're medically compromised. We could not go in there and provide support for them. And they do not have staff available to provide that specialized service. So this is a gap in their care. We also talked in our peer recovery coach expansion doing outreach. Again, our peer recovery coaches cannot bill for services that are in the community in a group setting. For example, Share the Warmth homeless shelter. A peer recovery coach could not go in there and do group therapy, in any form if it's not in an office setting. Insurance does not allow that to be billed. So this is really bridging the gap. Meeting people where they're at. They're not able to come into the office for whatever reason. We would like to be able to go to them. Our budget also includes money for care packages. Maybe it's not the message of like come for recovery. Maybe it's the message of a Narcan kit and a pair of socks. And this was somebody that met me behind the high rise. They came to me, they cared, and they want me to do better. And when you talked about flexibility in our budget, that is one thing that we discussed in here. We would request some flexibility. So if our staffing needs are not for 5 part-time employees, we would not need the technology or training budget. And we'd like to reallocate that to client care, maybe more packages or more hours spent in treatment and not money spent just on computers or laptops or something.
Yeah, and also longevity too. It's not something we talked about. We know in our initial proposal is for roughly a year contract, but we were thinking, well, what if, we didn't use all that funding within the year? Could that be extended further to maximize these dollars, and so that's something we're looking at, as far as, instead of trying to hurry up and spend this grant funding, is there ability to extend that out further so that we can maximize those within the things that Melissa and I were just talking about, like with, the jail funding. If something happened with those grants, can we use this, from September on and then into 2027 as well? Also, we've been making some good linkages in the jail with the people that are incarcerated there. We started this right at the end of December, so we've been about 2 months worth of services there. We've seen about 22 or more people, through that time. Most of them are still incarcerated. Some have been transferred to other facilities as far as other jails or other, like tri-county or
Residential
twin
care,
counties. Yeah, things like-
transitional housing.
yeah, so some of them have done that. Some have been released and we haven't heard from, but, we're still working on, getting people connected with CMH, with the recovery community as far as AA, NA, those different things. And so that's one of the things that we're, continuing to work on as far as that continuum of care, making that initial engagement, while they're incarcerated and then continuing their care post-incarceration. So that's one of our goals that we're still working on, and would be, this funding would help us do that as far as that outreach or trying to help people get connected, whatever resources they might need, not just, outpatient services, but, getting connected to a doctor or, whatever other dentist, things like that.
The last thing, special population, we talked about domestic violence in our original proposal, and we've been building relationships with Catherine Cobb. They provide a great resource for the community, and they're not specialists when it comes to substance use. So partnering with them and their residents or people who use I don't know if we knew this, but people can go to Catherine Cobb and not be a resident there and receive help and so resources and support. So continuing to partner with them and other folks.
Yeah, and that would be another area to use some of this funding is to help our recovery coaches make those partnerships, make those linkages with other agencies, you know, and have that, you know, strengthen that referral network that we're trying to build and strengthen throughout the county as far as a recovery network and really just a human services network overall.
You have questions for us?
No, I do. Does anybody else want to start or I can? Okay. Well, first of all, having some discussion with some other providers similar to yourself, it becomes obvious to me who, after all, I'm just a remodeling contractor that paid attention in school. You know, this is not my area of expertise, but the types of things that you're dealing with are not so neat and orderly that they fit into precise boxes because they're as variable as each human being that has different circumstances. Now, there's some things that are more cut and dry. Do they have Medicaid? Do they not have Medicaid? Is there, you know, does insurance cover this or not? Those kinds of things. But you're right. There's this whole, you know, really spectrum of issues that accompany each type of person, and none of them are so straightforward. So that's not a question. I guess that's just me trying to make sure I understand this.
That's accurate.
Yeah, very accurate statement. Yeah. Everybody's a unique individual and there's a lot of people that have very similar circumstances or needs and things like that. But yeah, and that's one of our hallmarks is treating the person as that individual with all their unique needs.
You had said something about flexibility, and I think some of you, I'll just draw your attention to their initial proposal was $165,000 for a date range of October of 2025 to January 2027. Their updated request is the same dollar amount, but the flexibility to extend that out over 5 years rather than that narrow range so that they don't feel compelled to burn those resources in that, and correct me if I'm wrong, in that short range, but to understand that it may take a while to get things in place and that they don't want to shortchange things because they weren't able to get everything together, and grant and other monies can change in the meantime. And they'd like to be able to try and extend that money to preserve those programs. Am I saying that correctly?
Yeah, that's very correct. Yeah, we didn't want to come down to the end of the grant term and then say, oh, well, we've got this amount of money. Let's just buy a bunch of, you know, care packages or, you know, those
Right.
kind of things. That wouldn't be a, you know, responsible use of those dollars. So being able to extend it and maximize that in the best way, which, you know, as we talked about this, you know, this is a new endeavor for all of us. And so there's going to be some kinks to work out as we go along. And so, you know, having that longevity will, I think, allow us to see what's working, what's not, what do we need more of, less of, those kind of things, to have that longer time frame within
And
that period.
the grant that allows you to be in the jail now, is that the burn grant? Okay. And that's something that, what was that, typically 1 or 2 years? 1 year. Okay. Okay, got it. And that's something you hope to renew year by year if possible. Understood. Okay, I've talked enough. Other questions? Commissioner Collins?
Well, as it relates to the burn grant, and maybe this is maybe a better question for the captain than you, but the burn grant's been around for years. In fact, probably many people in this room were little kids when the burn grant started, and it is renewed often. Is it your intent to supplement the burn grant with these funds? And if the burn grant goes away, then continue utilizing it. And if the burn grant is renewed, to continue supplementing the burn grant with these funds.
Well, right now, we would be utilizing the grant and as the partnership is written, but like I said earlier, you know, that's what we were hoping, like, because you never know. Like, yeah, it's been around for a while, but just because you apply for it once in a grant, you're not guaranteed to get it again, you know? So I think what happens with this kind of funding, it allows supplementation in a way that we can do things post incarceration. And then also it kind of gives that stopgap measure that if that money did go away, we're not just going to pack up and leave. You know, we would not do that even if the money ran out. We would come up with some type of different solution, but it helps to ensure that we can continue this service, you know.
I'm hoping
Long
if you
term.
do, that gives you greater flexibility.
Exactly. You know, but, you know, again, nothing is guaranteed in this world. So, the more that we can do to kind of protect this relationship and the service that we're providing, I think is going to be for the better.
And the burn grant services you're providing now are narrower in focus than this proposal, correct?
Well, yeah, I think what it is for is for those groups, that group setting, and then some individual settings as well. So, and I think that's why Captain Casey is here as well for some supplemental MAT services and things like that to try to, again, maximize effectiveness of intervention with incarcerated people, because, that we want to have better outcomes. We want to have less recidivism and better outcomes post incarceration. So, it's like anything, the more you can do, the better, so. But yeah, this would be in addition to anything there,
Right.
the MAP program and the burn grant. So it's like if we have three different focuses or three different resources, I guess, that's going to create a better outcome, I think, for those individuals.
Sure. Anybody else? Tim?
How many peer recovery coaches do you have right now? So-
Well, throughout our company, yeah, we have about 7, in our Adrian office, we have 2 full-time peer recovery coaches, and then myself and another therapist who are also recovery coaches. So 4 in the current Adrian office, but again, 2 of those have split roles that are not doing recovery coaching full-time.
Right, so part of their salary and stuff's covered by other grants and things like that. Because your budget included part-time positions and things like.
Yeah, so we're looking to recruit new peer recovery coaches. Also, some of it might be to help supplement their wages for services that are not billable currently, like we talked about in the community, at the hospital, things like that. So yes, we're looking to get some more people on board so that we can have greater coverage throughout the county, whether it's the hospital, the jail, in the community, wherever it's necessary.
So those services in the hospital that you said they're funded by they couldn't be covered by Medicaid if they're in the hospital. That would be covered by this type of grant while they're in the hospital.
Yeah, they cannot be billed. So a recovery coach can bill for in office, like in an outpatient office, or in the community if it's one person. But it can't be in the community if it's multiple people, and it can't be other locations. So like the jail or hospital, hospice can't bill.
But what can you build group for? What can you build group for? In the community, you can build only one person in that. So you can only do in office with groups.
Yeah.
Okay.
Which is, again, those are Medicaid rules, those are federal rules that, we have to follow, and so, that's our goal is to, how do we, go beyond that, right? Those limitations that are in place, I'm not sure exactly why those limitations are in place. At least the federal government decided they needed to be in place,
Yeah, we won't go there.
So yeah.
Not everybody has Medicaid. Some
Right.
people have no insurance and they fall in between.
Mhm.
They can't afford their private insurance, but they don't qualify for Medicaid.
Or
Stuff
even,
like that.
or even individuals that do have private insurance like Blue Cross Blue Shield, peer recovery services are not covered as a benefit within those health plans. And so this would allow us to do peer recovery services with people that have private insurance as well, because that's currently a gap there.
So you mentioned Share the Warmth. Are you currently working there?
No.
Or has there been discussion about working with Share the Warmth?
No, but that is one of our goals, right? As far as these community linkages. And again, part of it has been, some of these rules about where and when we can do groups, and so, one of our strategies would be to do it, if there wasn't any funding, to do it as part of like community outreach or volunteerism, but if there's funding available, I think it makes it easier for us to do that as a business, when there is funding available.
Would it count for funding? I'm sorry.
No,
Go on.
please continue.
For things, is group covered? Say if you were to meet as a group in Ebide Center, not just at McCall Vargas?
No.
No, so that doesn't count either.
Yeah, it has to be an established office of whatever provider
With
is
a,
going to be billing.
with a substance use license. like our facility is licensed.
I'm done.
No, thank you. And I gotta say, meeting after meeting, I just begin to think I got a layman's grasp on all of this. And every meeting I learn that there's 1,000 other things I don't yet understand. Any other questions? But I would, I mean, I know you've interacted with Captain Casey, obviously, and both aware that, you're back to do this, but you feel like it's been working well with the things you've been able to do with the burn grant in the jail so far?
Oh, most definitely. Yeah, it's been great, and we're seeing a lot of momentum being built, like anything, you first get started and, there's a couple of people that kind of come and go and things like that. But we're definitely in the mindset of if you build it, they will come kind of thing. And we've been seeing a lot more interaction over the last month and a half. And, with people consistently coming to the group therapy. And then now we're seeing a lot more individual sessions being booked as far as appointments go, and trying to, right now we're in discussion about adding another day to, to help us see these people that need that individual appointment. Yeah, so it's been great.
Thank you. I'll add a couple other, Mrs. Go ahead.
I'm going to follow Mr. Kelly's idea of another location. So if you were given an office at a location, say a Line or Evide, and ran a group in your office, right? Because you know that you could make that an office. Does the licensing have to be to your addressed only one office? Because people change numbers often, right? So how would that work?
Our specific location, Laura does allow for like branch locations.
Sure.
There are very specific rules about how far away it has to be and how many hours it's open and who's there and.
Sure.
So it would need to be another licensed facility, we would have to go through the application process, the fee.
Does it have to be, or can you do an addendum to your location? Because I know a lot of times, like, counseling agencies will have like an office at a church because they're allowed to have space and it works good for the community to do
Mhm.
that. So would that be an addendum to your license?
No, because like, for example, in our Jonesville location,
Mhm.
we have 2 residential buildings, each with their own license. And then in the downstairs of the one location, we have our outpatient offices, which also has to have a separate license, even though it's in
Okay.
the same building. So that's just the way that the state currently has their licensing.
So if you were given an office space, I'm just trying to be clear, right? If you were given an office space in another location, could you get that licensed for that under your services?
We could,
Possibly, but I don't know if that would help us because in the community, we can already bill for an individual session.
I'm talking group
Oh,
primarily, right?
I mean, possibly.
I'm
but
just thinking
yeah.
for many agencies,
Mm.
right? I'm just trying to think outside the box because I understood what Mr. Kelly was saying, right? Because that maximizes days and
I think
location.
possibly, but, I think about the overall facility
Sure.
and then their rules and how
Sure.
it aligns with the licensure rules and.
well, and back to the geographic part, if we were, say, in the city of Detroit, where the north side and the south side are 20 miles apart or something like that, where in Adrian, nothing is more than, 5 miles from anywhere. So I think the idea would be, well, you already have an office. Why don't they just go to that office where?
And I understand that's exactly what I was
Yeah.
talking about because I know that there's a lot of places they do groups in different areas across the
Mm.
city of Detroit.
Yeah,
You gave a great example.
yeah.
So I wanted.
So, and so we're looking
Thank you.
for, yeah, and I appreciate it. And what we're looking at is more like, kind of in the natural settings maybe where, we could easily go, as providers, more easily than somebody could maybe come to us.
So
You know.
think like the homeless encampments, people don't want to leave their things. They don't want, they have a tent and a rucksack and they don't want to leave their only tent and rucksack to come to the office, regardless of where it's located. But if we could go to them,
So you can do one-on-one peer
I think we can-
recovery with unhoused population as long as it was one.
Mhm.
yeah.
Yeah.
Okay, one-on-one.
Well, one of the things we talk about funding, we're always thinking about how can we maximize, sometimes limited funding dollars. And so say we went to that same homeless encampment and said, hey, we can meet with 6 people at once and go over these different things and talk about all this at once. That's really maximizing, our time and the funding too, instead of trying to say, okay, we're gonna meet with this person for 20 minutes, this for 20 minutes, something like that. So that's one of our ideas about that community engagement, meeting people where they're at.
Thank you.
Yeah, thank you. Just so you're aware, where we hope to be with this process as we go forward is, of course, we're going to see if there's a recommendation with these 3 proposals from this committee. Then the board, with luck, will take this up in April, but then you will have follow-up conversations because we're going to have a contract and some discussions with each of the people, offering to provide services that I'm sure you'll hear through Ms. Zisk, and we'll work out the final parts of that. So that's how we see the process going from here. And I will say to everybody, and hopefully other providers are watching, understanding these first 2 years, we're going to be very data centric. We need information on the jail population and the real need for MAT and what types. So that's going to be very important that everybody that's involved in these things is going to be able to get that back to us in a feedback loop. And we're probably looking at reestablishing another committee to have reports out from each vendor to the commission through that subcommittee to understand how things are actually playing out. Commissioner Collins.
Let me, I don't know if it's sound like a warning. Let me give a little advice in advance. The data that we receive, I would hope be in layman's terms.
We'll do our best. We'll do our best. Yeah, I hear what you're saying, and like, Commissioner Martis was saying, there's a lot of technicality that goes into it, and it's not always as easy to understand. So yeah, we'll do our best with the reporting to make it easily digestible.
Super. Thank you.
Thank you for the opportunity.
Oh, I'm sorry, sir. Do you have a question? Oh, okay. All right.
All right, thank you very much.
Captain Casey, if you'd like to join us. And thank you for your patience with this process.
Oh, no problem. Am I allowed to say ditto to everything that he said?
Absolutely. You'll never see me try to abridge your free speech privileges.
So, thank you for taking the time to meet with me here again today. It's been a few months since we've last met. And yes, there's been a lot of discussion centered around what we should do and how much it's going to cost. Our plan has not changed. Obviously, the ask or the amount of money that we're seeking has changed, but our plan is still the same. Our plan is to identify people when they walk through the door as to whether or not they need services. And I wish we had had more concrete data to provide this group prior to my last meeting, but there was some overlap. I had applied for the burn grant. We knew we needed a MAT clinic. I applied for the MAT grant, and that was going to be kind of my building blocks to success, hopefully. And the last time we met, we did not have Color Vargas in place. Like you said, we've since partnered with them through MOU, and he's correct. We have had great participation in this process so far. The one component that we don't have in place yet, which is part of the burn grant, is the mechanisms that you need at the booking and intake, where we ask the very specific questions to hone in on who needs what type of services, what type of medications that they need, and ultimately the treatment through counseling. So without that data, and again, we had asked other agencies that are similarly situated, size of our jail compared to theirs, but because there are so many different variables, and you mentioned that earlier, there is no cookie cutter process for identifying an individual and saying that's going to apply for everyone. Everyone is unique. Everyone's needs is unique. And so had a very difficult time finding a dollar figure for this group. But we're going to continue to go forward, hopefully, with the dollars that may be awarded and see if we can maximize those dollars to provide as many services as we possibly can for a much needed population. So the plan is to continue to have our healthcare provider assist us with identifying people, keep the data so that we, this year, and maybe the next year is a better way to say it, we will establish a baseline and we will have better figures for this group this time next year, I hope. We just don't have it yet because we're 2 months into the current services that we provide. We don't have the questionnaires in place at the booking and intake. And so it's kind of a shot in the dark as to how many people would need these types of services. Other variables that come into play are the types of medications that was mentioned earlier. Some Suboxone is the cheaper version of those medications, and the Sublocade is the one that is astronomically expensive. Those are things we don't know, but as we move forward, we should have a better understanding. So rather than the $150,000 that we were seeking annually, we're now asking for 75, and we're going to try to maximize those dollars to provide a mat service in our jail.
Super. Thank you for being flexible and your patience with the process as it plays itself out. And I don't want to speak for the whole commission, but as I think we did discuss privately, if there are people that need medically assisted treatment and the 75,000 is exhausted, I think within the funds we have available and what we have remaining, we certainly don't want to see people not served if there's a clinical reason that they need access to that medication, because we're all sensitive to the comments the sheriff had shared that at some point, we could perhaps be liable for not making things available that are medically necessary. I think we all share a commitment to make sure that's being taken care of. But I'm very interested in seeing the data that we get out of this year, because there's a lot of money coming yet, and we can certainly give a much sharper focus with our next round. It's not one and done by any stretch. So as one vote of 9, that's my humble opinion. Other members of the committee, questions? Commissioner Collins.
No question, just a comment. It seems like you're on the way, at least at some level, with McCullough Vargas, to establish a relationship with your partners, if you would, in this program. Because their win is your win and your win is their win. So when we receive this data, it's probably going to be intertwined with all three of you.
Yes,
Whatever numbers.
we have our jail program coordinator, Tamara Fitzgerald,
Right.
working very closely with McCullough Vargas and keeping statistics already on what we're already doing. And she actually has a couple of really good success stories, no longer than we've been doing.
Very good.
People who've gotten out of jail who have since found jobs and things of that nature.
Excellent.
Wonderful. Other questions, comments, anybody? Understanding we have 8 minutes minimum to fill before our next presenter can run in the door at the last second. Anything else? All right. Thank you. Thank you, Captain. We're certainly going to stay in close communication as we move forward.
Appreciate it.
And, the third part of this component we see is this telehealth component. It's our, this telehealth proposal will be for more than just people in the jail. Apparently it can be done through cell phone apps and those kinds of things. Doesn't require proprietary equipment. We'll get more details on that when the presenter from U-Turn arrives. Ms. Sisk.
Just to clarify, justice impacted was removed from the proposal, so now this telehealth will be for community. So
Does it exclude justice impacted, or
it doesn't
it's not
exclude, but
narrowed?
it's not going to be focused on for the jail. It's not going to be focused at the jail at all. So that justice impacted portion was removed, just to clarify.
But we're not excluding it.
That's
We're
okay.
just not limiting it to only justice impact.
We're not going to go to the jail to start it.
Right.
begin
Got it.
it.
So the community at large, the Lenawee County community at large, if you look at their proposal, will have this available to them
Correct.
with no limit that I saw on some of the peer interactive mechanisms that they have. I mean, there's obviously limits on the peer-to-peer, but anybody can access the telehealth things that are just basically, I don't know, I presume they're working through various programs and stuff online, much like you might watch a YouTube video and do a questionnaire kind of thing. Why don't we take a 5-minute recess? And then we'll come back instead of everybody looking at each other wondering what to do.
everyone.
Hello.
See you all again.
Thank you so much.
Pleasure.
We do have kind of a sort of hard stop at 4 o'clock, so I'd hate to put you in that spot, but here we are.
Let's rock, baby.
Okay.
I'm ready. So we put together an amendment for our original proposal. We had originally proposed a 3-year deal with the county to work primarily focused on reentry participants with the county jail. The new amendment, what we've come forward and proposed is to work more with the broader community. So looking at, okay, substance use disorder impacts the community at large as well as their families. So how do we work with, in addition to reentry participants, how do we work with families? How do we work with local community organizations? And how do we make an impact for the broader county community? What it doesn't change is what we provide. So we still provide access to all of our content. That would become a community-wide initiative. We'd still provide access to our peer-to-peer support coaching, and would still provide family support, which we consider family support sort of free or complimentary in the sense that if I come and I have a husband and children, they would also be offered those peer coaches as a part of that family unit. I think that the biggest thing here is looking at how do we figure out good referral sources. And so things that we've done in other communities that we work with. As a part of this proposal, I would say I would definitely continue to work with the county jail if it was something that you guys were open to. But in addition to that, what are other community resources that we can work with? So in other communities, for example, we've worked with local Boys and Girls Club organizations. We've worked with things like Catholic Charities. We've worked with local recovery centers. I think that providing or understanding if there are other either opioid proposals that would make sense for us to work with or existing community partners that you think would make sense for us to work with. Our goal would be to go in and say, this is available, to market it to them, and then to create that referral network pretty similarly to how we would do it within the county jail, just through a different avenue. That's probably the fastest I can summarize it. And since I have 6 minutes, I figure maybe I leave time for questions as well.
Well done. Just to be clear, because we had this discussion prior to your arrival, your previous proposal was primarily justice involved people. Now you're not excluding them, but you're broadening it to the larger Lenawee County community.
Correct.
Okay, got that. Any questions?
I don't have a question, just a comment. From our conversation last time, I thought of a great location just to start to include because we have a large library community.
Oh, love
So that would be also a great resource for there, right? Because there's a lot of people that travel through that library, just to caveat.
I like that. Yes.
And the thought that I had along those lines is you will see if you watch our commission meetings, hopefully in April, you will see we will approve a final list of these proposals of the 25 or whatever we received originally. We've narrowed down to what, 8 or 9, I think. At least I would hope all those vendors to the place, to the degree that you saw synergy there, would be open for communication, obviously. And I guess I would put it this way, most all of you would certainly like to be funded again in the future. So showing that everybody works together well would be a great incentive to stay at the top of that list.
Agreed. And we've had other counties that we've worked in, whether they have certain job resources or certain treatment centers or different things that make sense to partner with. I think that that only strengthens how we're able to support the group that we work with as well, to have places to refer them to or people.
Sure. Other questions, other thoughts? Sarah?
Sorry if I missed this part of it. Is the amount requested changing or that staying the same? So where is that? Just don't see it.
It would be on your sheet, this one.
Oh, so that's the adjusted amount.
Correct, for the 2-year proposal. So it was less 1 year. It would divide it by 3.
Yep. Okay, thank you.
And that was driven by a couple things, but we were kind of up against our budget limit, but we we're also looking for a way to create a broad availability for telehealth. Tim?
I think I know the answer to this, but everything going to be delivered telehealth? There's not going to be peer coaches here.
Correct. And we have found that to be very successful. I mean, we've been doing this for a while now. I think that there are people who prefer in-person, and I have done some research of existing, community organizations that may be able to provide that. But then there are folks that, whether they're calling on their way to work, they're calling after hours, it's more in the moment support as well. And so while face-to-face is great, typically when you're working with one of our peers, you and I could speak right now, and then maybe you have a meeting and you say, I'm going to call Bridget after that meeting as well, right? And so that in the moment or virtual support is really supported by both those by those video visits and the phone call visits. Yeah.
Anybody else? And just so we're clear, so like, you probably use a different phrase, but you have your online content that there's not really a limit to people, the number of people that can access that, which is different than the peer-to-peer, which I presume there's a limited, obviously, there's so many resources, right?
Correct. Yep. And the way that we could do the content in several ways to access it, but typically there's a unique code that's given to anybody that wants to access the content. And then as we ramp up sort of the amount of people that either we know about us in the community, or we look at who we're reaching, then we'll do some direct outreach too. So maybe if it's Suicide Prevention Month, we'll send some resources or something of that as we kind of grow the list of folks who are within the platform.
Super. Anything else? Tim?
So, is there any restriction on age? Meaning, can your peer coaches work with youth?
We have worked as young as like 14 years of age. We do not work with youth. That's a really pretty specific subset. And when we do that, we want to make sure that we get it right. So we like to work with probably 17, 18 and up, but we have to be as low as 13, 14.
Anything else? Right, well, thank you so much. I feel so bad that your whole day was consumed for 5 minutes, but I appreciate you taking time to come.
Done. No apologies.
Super, thank you so much.
Okay.
Yep.
Thank you, guys. Pleasure to see you.
So just before we take public comment, I believe we have one last item of business. I would entertain a motion to recommend these 3 amended proposals forward to the full board for consideration. So we got a motion from Commissioner Collins. Is there a second? Second. Any further discussion? Seeing none, all in favor signify by saying yes. All opposed, say no. Thank you. Appreciate it. Public comment. Is there any public comment? Pretty confident there is not, but I will ask one more time. Any public comment? Oh. I bundled all 3. Oh, I thought we did. Well, then let's do this. I would now entertain a motion to recommend the all the items on the list, this amended list. We take a motion to recommend all of these now, including these 3 amended ones, to the full board. Is there a motion to that effect?
So move.
It's been moved and seconded. Any discussion? All in favor signify by saying yes. Opposed, no. Thank you. All right. Any public comment? Seeing none, I'd entertain a motion to adjourn. All right. Thanks. All in favor? Yes.